Atomy Tri Active Calcium. Triple complex calcium formula for bone health. Health functional foods. 800 mg by 180 capsules or total 144 grams. At one's own discretion, reliable and strong. 6-fold complex functionality plus 5 additional ingredients. 6-fold multifunctionality with 5 functional ingredients such as nutrients that help the body absorb calcium in the complex calcium ingredient comprised of 3 different kinds of calcium. Plus, we've added 5 additional ingredients. For healthy bones, rely on Atomy Tri Active Calcium. 3-type complex calcium formula for bone health, Atomy Tri Active Calcium. 3-type complex calcium formula for bone health, Atomy Tri Active Calcium. Atomy Tri Active Calcium. Seaweed calcium, calcium citrate, whey calcium. Product details. Product name, Atomy Tri Active Calcium. Product type, health functional foods, calcium, magnesium, copper, manganese, vitamin D, vitamin K. Net contents, 800 mg by 180 tablets. Ingredients: seaweed powder, magnesium oxide, calcium citrate, milk calcium, manganese sulfate, dry vitamin D3, copper gluconate, dry vitamin K1, microcrystalline cellulose, carboxymethyl cellulose calcium, hydroxypropyl methyl cellulose, magnesium stearate, stearic acid, Chinese dodder Cuscuta chinensis seed extract powder, chaga mushroom Inonotus obliquus extract powder, Siberian ginseng Eleutherococcus centicosus extract powder, safflower Carthamus tinctorius seed extract powder, fermented Acaranthus japonica extract powder, glycerin esters of fatty acids, contains milk. Recommended use: take 1 tablet each time, 3 times a day with water. Storage method: store in a cool, dry place away from direct sunlight, and keep out of reach of children. Nutritional facts. This is the nutrition facts of Atomy Tri Active Calcium per recommended daily intake of 3 tablets or 2,400 mg. Product features. Atomy Tri Active Calcium systematic design for bone health. Calcium intake is important, but absorption is more important. Please check the ingredients and absorption rate before consuming. What makes Atomy Tri Active Calcium a worthy choice? First, 6-fold complex functional product, contains magnesium, vitamin D, vitamin K, copper, manganese. Second, 3-type calcium complex formulation, consisting of 1. Seaweed calcium, a vegetable calcium, 2. Calcium citrate which is easy to absorb and digest, and 3. Whey calcium, an animal calcium. This 3-type calcium complex formulation provides 3 kinds of calcium evenly. Third, enriched with 5 types of additional ingredients. They are Siberian ginseng, safflower seed, tosaha, acaranthus, and chaga mushroom. Fourth, ideal ratio for easy absorption. Ratio of calcium and magnesium is 2:1. Calcium 450 mg per day, magnesium 225 mg per day. Product features of Atomy Tri Active Calcium. Number 1. 6-fold complex functionality. Atomy Tri Active Calcium contains 6 main ingredients: calcium 450 mg, magnesium 225 mg, vitamin D 15 microgram, vitamin K 70 micrograms, copper 0.8 mg, and manganese 2.25 mg. Calcium is necessary for bone and tooth formation. Necessary for maintaining nerve and muscle functions, necessary for normal blood clotting. Magnesium is necessary for use of energy, necessary for maintaining nerve and muscle functions. Vitamin D is necessary for absorption and use of calcium, and phosphorus, necessary for bone formation and maintenance, helps reduce the risk of developing osteoporosis. Vitamin K is necessary for normal blood clotting and necessary for bone construction. Copper is necessary for transport and use of iron and protects cells from harmful oxygen. Manganese is necessary for bone formation, necessary for use of energy, and protects cells from harmful oxygen. The calcium used in Atomy Tri Active Calcium is a 3-type calcium complex formulation. It is formulated from seaweed calcium, calcium citrate, and whey calcium. Seaweed calcium. The seaweed calcium comes from the seaweed calcium vegetable from Iceland. It is plant-based marine mineral and non-calcined calcium. With non-calcined calcium honeycomb porous structure, vegetable seaweed calcium is easy to digest and absorb. Seaweed calcium in Atomy Tri Active Calcium is taken from red algae. Its scientific name is Lithothamnium coralioides and Phymatolithon calcareum. The photosynthetic action and absorption of minerals and nutrients happens in seawater. It has a unique property of accumulating only minerals in the cell wall. Calcium citrate. Calcium citrate is also known as lime citrate. It is used as a strengthening agent and acidity control agent in food. It is manufactured by dissolving citric acid in water and neutralizing or purifying it with calcium hydroxide and collecting or drying the precipitate. Calcium citrate is known to be easy to digest, so the burden on digestion is low but the absorption rate is high. Whey calcium. Whey calcium is obtained by centrifuging milk and separating only the calcium component from whey. It is excellent for supplying calcium due to high absorption rate in the body. Magnesium. Magnesium is involved in the enzyme reactions in the body. Magnesium acts as a cofactor in more than 300 enzyme systems, and acts as part of the magnesium ATP complex in the process of generating anaerobic and aerobic energy or by directly activating enzymes. Magnesium is also necessary for biochemical or physiological processes occurring in the body, such as the synthesis of fat, protein and nucleic acid, and muscle contraction. Magnesium plays an essential role in the maintenance of cell membrane potential of nerves and muscles, and in the impulse conduction at the neuromuscular junction. Magnesium is necessary in nerve stimulation and muscle control. Magnesium, along with calcium, potassium, and sodium, regulates nerve impulse transmissions and muscle contraction and relaxation. Vitamin D. Vitamin D helps the absorption of calcium. Atomy calcium contains vitamin D, which is important for regulating blood calcium and phosphorus levels in the normal range and for maintaining balance. Oily fish is a good source of vitamin D, and it can be obtained from foods such as eggs, butter, liver, and sunlight. However, it is known as a nutrient that modern people are susceptible to deficiency in due to lack of outdoor activities. Calcium, magnesium, and vitamin D. Calcium and vitamin D. Vitamin D3 plays an important role in bone health by increasing the absorption of calcium and phosphorus to keep the calcium concentration in the body constant. In addition, when the body's calcium level is insufficient, it helps to reabsorb calcium so that it is not excreted to reduce the risk of osteoporosis. Calcium and magnesium. Calcium and magnesium always need one another for absorption. However, it's also a strange relationship in which high calcium intake decreases the absorption of magnesium, and low calcium absorption increases magnesium absorption. It is important to consume calcium and magnesium in an ideal ratio in order to promote calcium absorption and maintain mineral balance. Vitamin K. Vitamin K is necessary for the construction of bones. Vitamin K helps the synthesis of osteocalcin protein mainly present in bones. Vitamin K is involved in the synthesis of blood clotting factors in the liver. Vitamin K makes prothrombin to help normal blood clotting. Vitamin K main source foods include broccoli, parsley, green tea, grains. Copper. Copper helps absorb and use iron. Copper helps the absorption and movement of iron and helps the synthesis of hemoglobin by being involved in the transfer of stored iron to the hemoglobin synthesis site. Copper plays a role in preventing oxidative damage to cells. Source foods of copper include mushrooms, bananas, tomatoes, and grapes. Manganese. Manganese is nutrient essential for skeleton formation, amino acids, cholesterol, carbohydrate metabolism. Manganese is involved in various enzyme reactions in the body that affect the synthesis of sugars, the prevention of lipid peroxidation, the catalyst for element formation reactions, and the promotion of ammonia elimination reactions. According to this, it is involved in the metabolism of sugars, proteins, and lipids and contributes to the formation of bone or cartilage. Source foods of manganese include seafood, peanuts, seeds, green tea. Product features of Atomy Tri Active Calcium No. 2. Enriched with 5 types of additional ingredients. Atomy Tri Active Calcium is enriched with 5 types of additional ingredients. They are Siberian ginseng, safflower seed, tosaha, acaranthus, and chaga mushroom. Acanthopanax centicosus, often called Siberian ginseng, has been universally used for the treatment of a variety of human diseases. It is popularly used as an adaptogen drug and could invigorate qi, strengthen the spleen, and nourish the kidneys according to the theory of traditional Chinese medicine. Safflower seed oil is a rich source of the essential fatty acid, linoleic acid. The linoleic acid in safflower oil might help reduce the risk of heart disease. Safflower also contains chemicals that might help prevent blood clots, widen blood vessels, lower blood pressure, and stimulate the heart. Tosaha benefits include strengthens bones and back muscles, strengthens the liver and kidneys, promotes blood circulation, helps with male infertility symptoms, improves vision health and prevents night blindness. Acaranthus japonica extracts contained various positive physiological benefits, such as anti-allergic, hepatoprotective, anti-inflammatory, alleviation, antioxidant, anti-cancer and arthritis functions. For centuries, people have used chaga mushrooms for medicinal purposes. Packed with antioxidants, its extract may fight cancer and improve immunity, chronic inflammation, blood sugar and cholesterol levels. Product features of Atomy Tri Active Calcium No. 3. Small tablet size that is comfortable to swallow. A small tablet size that is comfortable to swallow. Anyone can consume it without any burden. Easier way to maintain bone nutritional balance. Take 1 capsule 3 times a day with water. Atomy Tri Active Calcium is recommended for teenagers in growth period with active growth and development, pregnant and breastfeeding women who need calcium supplementation, modern people with insufficient calcium intake, women in menopause, middle-aged people, and elderly people who tend to have weak bones. People who are concerned about nutritional supplementation due to irregular eating habits. Those who want calcium supplementation for bone health. Those who want smooth body physiology control. Those who are concerned about bone health. Precautions. Avoid this product if you are allergic to any of its ingredients. Discontinue use and consult your doctor if adverse reactions occur. Do not consume products that have passed their expiration date. The pattern on the tablet is made of plant extract, which is an additional ingredient, so consume with confidence. Health information. Lack of calcium and vitamin D in the body and increased probability of osteoporosis. Osteoporosis occurs when bone production decreases compared to bone loss. Usually, due to natural aging due to increased age, liver and kidney functions decrease, reducing the possibility of converting vitamin D into active 1,25-dihydroxycholecalciferol, calcitriol, limiting intestinal absorption of calcium, which is important for bone production, and increasing calcium excretion in the kidneys, increasing the chance of osteoporosis. But osteoporosis doesn't just occur in older patients. Bone mineral density in the body peaks in the 20s and early 30s, and then continues to decrease afterwards. The number of osteoporosis treatments increases steadily every year. The table shows the number of people treated for osteoporosis as of 2016. Osteoporosis cases increase with age. The table shows the number of patients with osteoporosis disease per 100,000 people as of 2016. Approximately 1.5 out of 10 people have osteoporosis. Food for strong bones. Recommended food: low-fat milk, fish, blue-backed fish, seafood, lentils, tofu, sesame, fresh vegetables, fruits. Food to avoid: salty food, soft drinks, coffee, alcohol, excessive protein, acidic food, excessive grain or fiber. Vitamin D intake. The recommended daily intake of vitamin D, according to the Korean Society for Bone and Mineral Research, is 800 IU or more, which has proven effective on the musculoskeletal system. The proper concentration of 2,5-OH vitamin D in serum is 20 to 30 nanograms per milliliter or more. The recommended upper limit intake for adult males and females is 4,000 IU.